Center, COVID-19 weekly briefing, today the 10th of March 2021. Thank you for joining us as usual for this briefing. We continue to update you, bring you information with what is happening in St Kitts and Nevis with respect to the management of the COVID-19 pandemic. Your part, the role that you play in that management is extremely important. We are at a critical stage of the journey in the pandemic. We are at the vaccination stage, and people have been coming forward. Close to 5,000 people so far have been vaccinated. There have been no deaths from the vaccine. There have been no hospitalizations from the vaccine. There has been no serious side effects from the vaccine. And we have seen that close to 5,000 people have been vaccinated. It is your opportunity to be vaccinated. And we encourage you to be vaccinated, as Dijon encouraged you in that song that he performed. It has been 1 year, just a little over a year, since the pandemic started. And in that time, we have seen the devastation that it has wreaked on the world. 2 million, over 2,600,000 people would have died from the COVID-19 pandemic. Others hospitalized, others suffering mental health issues, from mental health issues and so on. The pandemic is not over, but it is important that we take the vaccine so that we can get back to some semblance of normalcy. If we want carnival, if we want to travel, and so on, it is important that we step up and get the vaccine. Today, I invite Superintendent Cromwell Henry, who usually starts the batting, and he's the Divisional Commander for District A and a very committed member of the National COVID-19 Task Force. Superintendent.
Thank you very much, Mr. Williams, and pleasant good afternoon to all listening to this broadcast via whatever means. I know you spoke of vaccine, Mr. Williams, and the emphasis, the focus these days is on being vaccinated, and we encourage it, but we don't want us to lose sight of the other measures. The vaccine is one measure, but there are other measures that we need to continue to adhere to observe, until we are fully vaccinated. Then we could begin the easing of restrictions. So today I will speak a bit on the mask, because that is one of the measures that would help to keep us safe. The COVID-19 Prevention and Control Act was recently amended in Parliament, and this amendment prescribed how face masks must be worn. We are seeing persons wearing their masks other than over their nose and mouth. But we know health officials have advised that, notwithstanding the vaccine, the wearing of the face mask in public is still an important COVID-19 prevention measure. And so the amendment to this act reads as follows. Notwithstanding the provisions of the Small Charges Act, and we know the Small Charges Act previously prohibited the wearing of face masks. Now this act is saying, in an effort to prevent the spread of the COVID-19, when in a public place, a person shall wear a face mask covering his or her nose, mouth, and chin. The act also defines public place, and it defines public place as, well, it includes indoors or outdoor area, whether privately or publicly owned, to which the public has access by right or by invitation, express or implied, whether by payment of money or not, including shopping centers, supermarkets, pharmacies, banks and utility departments, bars, drinking places and restaurants, hotels, schools and all other educational institutions, hospitals, whether publicly or privately owned, churches and other religious establishments, public transportation, community centers, government offices, public markets, and other places of or buildings of all types accessible to the public. A failure to comply with this provision could result in fixed penalty notice being issued by a police officer or a compliance officer. We continue to urge and encourage our people to vaccinate so that we can begin easing some of these restrictions and return to our pre-COVID normal. Thank you.
Thank you very much, Superintendent Henry. I now invite our Chief Medical Officer, Dr. Hazel Laws, to present us with the Health Emergency Operations Center Situation Report. Dr. Laws.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone. This afternoon, as per usual, I'll share with you the Health Emergency Operating Center Situation Report for Wednesday, March 10. Ladies and gentlemen, I bring to your attention that we have an increase in the number of confirmed cases. So St Kitts and Nevis today would have identified an additional imported case of COVID-19. And so that brings our total to 42. So 42 confirmed cases of COVID-19, 29 St. Kitts, 13 Nevis. Please note that 24 days would have elapsed between our identifying case 41 and today case 42. So 24 days elapsed without our identifying any additional imported cases. So as of today, St. Kitts and Nevis, we would have reported 42 confirmed cases of COVID-19. 41 cases have fully recovered, and so at present we have one active case in isolation and is being monitored. Based on the World Health Organization's COVID-19 dashboard, approximately 117.3 million persons have been confirmed with COVID-19 globally, and over 2.6 million persons have died from this disease globally. In the United States of America, they would have confirmed over 29.1 million cases and reported over 527,000 deaths as a result of COVID-19. In the Caribbean region, the total number of confirmed cases is over 550,000. That's in the Caribbean region. But amongst the CARICOM member states, the confirmed cases, the count is over 114,000 persons. In the Eastern Caribbean islands, Antigua and Barbuda, 862 confirmed cases of COVID. Barbados, it's over 3,300. St. Lucia, over 3,900. St. Vincent and the Grenadines, over 1,600 confirmed cases of COVID-19. Today, another batch of RUSVM students would have come into the Federation. We had 74 students coming in from Miami and 2 from Puerto Rico. So a total of 76 students are now in quarantine on the dorms at the RUSVM campus. Again, we are going to follow the same protocols. They will be tested upon arrival. They will spend 14 days in quarantine, be tested on day 14, and then they will be officially released from quarantine once their results would have returned negative after that test on day 14 of quarantine. To date, we would have tested over 10,000 persons. Again, 42 results returned positive, with a positivity rate of approximately 0.4%. And then this just underscores 41 cases would have recovered. We have 1 in isolation, so a total of 42 confirmed cases. And then you see the number of persons in quarantine at present, 386. We would have released over 5,800 persons from quarantine. That's from over the period of about a year. All right, so this afternoon we are going to talk again about the COVID-19 vaccine. So we would have received 2,000 doses as a gift from Dominica. We would have received 20,000 doses from the government of India. As a federation, we are expecting our allotment through the COVAX facility, and that's about 21,600 doses. Please note that access to COVID-19 vaccines is very, very important, because this is a sure way of curbing the spread of this disease. Now we are offering or rolling out the AstraZeneca Oxford COVID-19 vaccine here in the Federation. I just wanted to reiterate some of the characteristics of this vaccine. Based on the clinical trials, it offers a 63 to 83% risk reduction in contracting the actual disease itself. We are administering this vaccine. The dosing schedule is 2 doses. So persons who would have received the first dose, you are given a 10-week appointment to return for the second dose. Again, it's indicated for individuals or adults over the 18 years of age. And so that's an absolute. It's only given to adults over 18 years. So that's an absolute. The science tells us that it's quite effective against the SARS-CoV-2 variant that was identified in the United Kingdom. And so far, the side effect profile of this vaccine seems to be reasonably mild and minimal. In terms of, I will explain further in this presentation some of the side effects that the persons locally are describing. This vaccine was manufactured by the Serum Institute of India, very reputable entity. Please note that over 90% of the vaccines utilized globally were manufactured by the Serum Institute of India. So it's a reputable organization. We rolled out our vaccine campaign on Monday, February the 22nd, and in just 2 weeks, in 14 days, because I think we've been vaccinating now between then and now for about 14 days, because we are actually also offering this vaccine on a Saturday mornings at the Newtown Health Center. And so over the past 2-week period, we would have vaccinated 5,176 persons. So we would have administered 5,176 doses. And so we would have reached 15.67% of the target population. This just highlights further. So as I said before, we would have administered 5,176 doses, 3,699 doses in St. Kitts, 1,477 doses administered in Nevis, 15.67% of our target population. So who can access this COVID-19 vaccine? I'm going to spend some time on this slide because we're getting a number of questions as to who can come in to any health center and access this vaccine. So once you're over 18 years, over 18 to 80 years of age, you can walk freely into any health center and request this vaccine. If you are 80 and if you are over 80 years, we are just recommending that you go to your regular physician, be evaluated, and get the nod of approval that you can proceed in getting the vaccine. So anyone within this age range can just walk into any health center, St Kitts and Nevis, and access this vaccine. So in other words, if you're working in the private sector, you're a cashier, or you're in an entity where you are serving the general public, it means you are at risk of picking up SARS-CoV-2 virus, you need to be vaccinated. If you're a civil servant and you're interacting with the general public, your job requires that you interact with the general public. That means you're at risk of SARS-CoV-2 virus. You need to be vaccinated. So if you're a customer service representative, if you're a cashier, if you are working in the utilities, one of the utility companies, and you have to serve the general public, you are at risk of being exposed to the virus, and so you are a candidate for vaccination. We are getting a lot of questions from individuals with chronic medical conditions, and they are asking, if I have diabetes, can I take the vaccine? Yes, you can. If I have hypertension, can I take the vaccine? Yes, you can. If you have asthma, you are a candidate for the COVID-19 vaccine. If you have heart disease, if you have kidney disease, if you have arthritis, if you have any of these chronic medical conditions, and this list is not exhaustive, okay? So if you have any questions, just call your regular physician, just, get that nod of approval, and then you can go to the nearest health center to access this vaccine. And some persons are asking, I am taking aspirin, ASA, 81 milligrams or 325 milligrams. I've been doing so for months, years. Can I take this vaccine? Yes, you can. And so a number of persons on the, diagnosed with these chronic medical conditions, you are taking medication, antihypertensive, anti-diabetic medication. Yes, these are not contraindications for taking the vaccine. So feel free, if you want to back check with your regular doctor, once you get the nod of approval, you can go to the nearest health center to access the vaccine. Again, the health centers are the official or designated COVID-19 vaccination sites, all 11 health centers, St. Kitts, all 6 health centers in Nevis. Okay, so what's the vaccination process? So once you would have armed and empowered yourself with the facts and the information, we wanted to make an informed decision to take this vaccine. So on the day you decide to go, make sure to dress appropriately, short sleeves or sleeveless, so that you can easily receive your intramuscular injection in your left or your right arm. When you go to the health center, the nurses they are going to ask you to complete the pre-vaccination checklist. You would get your first dose, and then upon receipt of your first dose, you will be given your COVID-19 vaccination record card. This is a very important document. We want you to keep it safe and secure, like you do all your other immunization records. After receiving the vaccine at the health center, it's recommended that you sit in the waiting lobby of the health center for 15 minutes, just to make sure there aren't any untoward reactions or allergic responses to this vaccine. So after 15 minutes, you are free to go. You'll be given an appointment to return in 10 weeks to get the second dose. Upon receipt of the second dose, your vaccination record card will be stamped, and that will be your official record of your COVID-19 vaccination. Okay, so at this time, there are 1 or 2 individuals who are experiencing the common cold with fever. We ask if you are in this category, we'll ask you, or we will recommend that you postpone vaccination until you would have recovered. If you're pregnant at this time, if you're breastfeeding, we also ask that you postpone vaccination. Now, the only 2 absolute contraindications to this vaccine are 1, if you're under 18 years, and 2, if you had or if you experienced a significant allergic reaction to the first dose. Those are the only 2 absolute contraindications to receiving this vaccine. The Ministry of Health would have developed a comprehensive communication strategy and plan, and the aim of which is to empower our people in terms of with the information so that we can create the demand and acceptance of this vaccine. So what are some of the common post-vaccine symptoms? And so persons who would have received this vaccine locally would have described tenderness at the injection site, like I did in my left arm. So I received my vaccine a week ago, and there isn't any tenderness. My arm is quite fine. Some persons complained of feeling cold or chills on the evening after receiving the vaccine, and some describe even experiencing a mild fever relieved by just simple paracetamol or acetaminophen tablets. Feeling malaise, fatigue, some described body aches and pains, and some complained of just mild headache. So these are the most common post-vaccine symptoms being experienced locally. Okay, we at present, the Ministry of Health, we are hosting stakeholder meetings. We would have engaged and had educational talks with some of our stakeholders, and the aim of which is to empower our people, provide the facts so that our local individuals can make informed decisions and accept this vaccine. And so the Ministry of Health would have had sessions with immigration, customs, the various hotels, and public and private sector entities. So if there are any stakeholders in need of such a stakeholder meeting, simply call 311 and then we will facilitate same. The goal, our ultimate vaccination goal, is to vaccinate our adult population. Based on our last census, the number of persons between age over age 18 constituted or made up 72.4% of our population. So that's our target population. While we vaccinate our people, we must continue the essential public health actions to suppress transmission and reduce mortality. And so the Ministry of Health, we continue active surveillance, looking out for persons who exhibit the signs and COVID signs and symptoms. We continue testing, and we continue advocating the COVID-19 prevention and control measures. Ladies and gentlemen, get the facts, choose the vax. Choose the Oxford AstraZeneca vaccine. So say yes to the vaccine. Ladies and gentlemen, saying yes to the AstraZeneca Oxford vaccine is saying yes to keeping our schools open. Our children need to go to school. We need our schools to remain open, and not even on a shift system. Our students want to experience school like they did a year, 2 years ago. So saying yes to the vaccine is saying yes to our schools remaining open. Saying yes to the vaccine is saying yes to church without limits. Choosing to take the vaccine is saying yes to funerals without limits. Choosing to take the vaccine is saying yes to football with spectators. Choosing to take the vaccine is saying yes to basketball and cricket with spectators. Here's a picture of some football lovers standing on cars just, trying to get a glimpse of the match. We want everybody to go back into our stadiums. Saying yes to the vaccine is saying yes to events and parties without limits. Saying yes to the vaccine is saying yes to Carnival 2021. Hopefully. The vaccine is our best shot. Our best shot at protecting ourselves, protecting our families and loved ones, protecting our communities, rebuilding our economy. Thank you.
Thank you, Dr. Laws. I see you had an option there, say yes or no, and I would say yes. And earlier I mentioned that we were just about 5,000 persons vaccinated, and that has been updated. It's over 5,000 people vaccinated. I now invite Mr. Abdias Samuel, who is the chair of the National Covid-19 Task Force and our National Disaster Coordinator, to give his presentation.
Thank you, Mr. Williams, and a pleasant good afternoon to all. I want to start my presentation this afternoon by welcoming the 29 new compliance officers that would have graduated last week, Friday. They are now going through a process of on-the-job orientation at various quarantine sites and also working the corridor of containment and visiting business places. We are asking the general public to support the work of these individuals who have dedicated themselves to service of country above self. So these 29 officers will be posted eventually to strengthen the corridor of containment. So they will work between the airport and the quarantine sites or the vacationing in place facilities. They will also be visiting the business places. So I'm asking the business places to ensure that you are adhering to the guidance of the protocols. Superintendent Henry would have spoken to the amended legislation for the wearing of face masks, and we are pursuing to have the tickets printed as soon as possible so that the compliance officers can enforce the regulation of wearing the face mask. So we are again appealing to citizens to wear your mask until we reach our threshold for herd immunity. Today, we heard that we now have 42 confirmed cases of the COVID-19, and we have to commend everyone who continues to do their diligent work in keeping our borders and keeping the country safe. As of the 7th of March 2021, since our borders opened on the 31st of October, we have had a total of 4,114 arrivals into the Federation. That's 3,732 into St Kitts, 382 in Nevis. And this data is as of the 7th of March. This in itself speaks to the work that is being done in containing the virus. here in the Federation of St Kitts and Nevis. So out of 4,114, we have had only 42 confirmed cases. The Ross University students that arrived, I'm understanding that this is the last batch for this term, and the next arrival will be in May. So again, we want to thank the Ross University for the continued contribution to the economy, because what they do is in support of us jump-starting our economy again. I want to give special commendation to the Nevis Culturama Committee for their impressive presentation to the National COVID-19 Task Force as per how they can use innovation and technology in hosting a safe Culturama, a safe Culturama in the context of COVID-19. I think that they have learned well and they have done a great job. But the greater commendation comes for their willingness to support what is being done in the Federation regarding the vaccination rollout program. And we want to also commend, in this same vein, the St. Kitts Carnival Committee and its leadership, in particular, Ms. Shannon Harley, who has been active in promoting support for the vaccination rollout program. What was pleasing to me over the last few days is to see entertainers, young entertainers like our local DJ, Sister Sensia, who would have been promoting her vaccine, being vaccinated, and we want to encourage more persons to continue to do so. Ladies and gentlemen, citizens, residents, the urgency must be adopted by all of us right now to bring a sense of normalcy to the country. In this vein, I'm appealing to the private sector to continue to doing their work, in particular, the Chamber of Industry and Commerce, who continues their support by promoting the vaccination rollout program through radio programs and using other forms of media to appeal to their membership to support the vaccination. Sporting communities, in particular, the football, basketball, athletics, and everything else that have been making presentation to the task force, please encourage your members to take the vaccine. Churches, we have been consulting with the Evangelical Association and the Christian Council to encourage the congregation to be receptive to the public awareness campaign and also the administering of the vaccine. Our volunteer groups, the DEMA district managers and volunteers, the Rotary Club, Lions Club, St. Kitts and Nevis Youth Parliament, the Red Cross, youth groups, explorers. So this general appeal is to all of you in the communities to do everything in your powers to go from house to house and take the message to everyone to vaccinate. I cannot end my presentation without supporting the work that is being done by a number of media houses, whether it be the radio stations, television, newspapers, digital media, and talk show hosts who are appealing to the general public to go and take the vaccine. Ladies and gentlemen, I want to make the clarion call. Just as if we are being impacted by a Category 5 hurricane, to take the message of vaccinating to every single citizen in this country. And I will end by saying, we are all in this together. Let us continue to flatten the curve, putting God first, love for country, love for each other, and love for self by vaccinating. Thank you.
Thank you very much, Mr. Samuel. Now that brings us to the question and answer segment, and I will start the ball rolling with the first question. How many practicing medical doctors are there in the Federation? And of that number, how many have already taken the COVID-19 vaccine or have committed to taking it? Dr. Wilkins.
That's a good question. I don't know the exact figure off the top of my head, but I can tell you that we have over 50 doctors in the Federation, and of that number, I would say more than 90% of them have taken the vaccine already, and every specialist working at the hospital, be it in internal medicine, surgery, orthopedics, etc., most of them have taken the vaccine. And so if they're taking the vaccine and these are persons who are knowledgeable about medicine, then it means that they are doing something good, and you probably should follow too.
Thank you, Dr. Wilkinson. The second question, I was told that taking paracetamol prior to being vaccinated reduces the side effects. How true is this? Dr. Wilkinson.
Some of the common side effects after taking or getting the vaccine is a low-grade fever. You might have headache, little joint pains, backaches, etc. And paracetamol is antipyretic, which means that it helps to control fever. It's also an analgesic, helps to take away pain. And so it follows then that if you got the vaccine and you took paracetamol or Tylenol, it will help to control these minor symptoms.
Thank you. These questions are from WINN Radio. One of them, of course, has been asked repeatedly, and I suppose for emphasis, it can be answered again. Seeking proper clarification whether returning nationals or tourists will be required to go through the 14 days of quarantine, even if they have been vaccinated. The second question, Dr. Wilkins, answer. And then.
That's why I'm glad that you said that it has been asked several times before. And sometimes persons ask me, how could you come up here and smile, answering the same question over and over again? I believe that every question is important, and it's important for us to repeat ourselves for reinforcement. And so we have said before that getting the vaccine, although evidence is showing now that it can decrease your risk of transmitting the virus, there's a percentage of persons who can still transmit the virus even though they have been vaccinated. And while we remain a virgin population, haven't been exposed to the virus with any community spread, and the fact that we have just started our vaccination program and only about 15.5% of the population have received the first dose, it means that if someone was vaccinated and came in here and tested positive, they can still transmit the virus to our persons. And so until we get to herd immunity, you would not see any change in the quarantine procedures. And so yes, no matter whether you're a returning national, foreigner, once you are coming here, you need to be quarantined.
I'll ask these two questions, and they're from WINN Radio as well. Have there been any negative reactions from persons who have taken the vaccine in St. Kitts thus far? I suppose Dr. Laws can say what has been reported with respect to that. And the third question from WINN Radio, as we have rolled out our vaccination program, will it be mandatory for persons coming into the Federation to be vaccinated, or does it remain optional?
Okay, so in my presentation, I would have described the common post-vaccine side effects that our people have been explaining or expressing. So persons who would have received the vaccine, they describe pain and tenderness at the injection site, feeling cold, and having or experiencing chills in the night following vaccination. Some complain of mild fever, feeling loss of energy, not as energetic as you usually do, body aches, pains, and mild headache. So these are the common post-vaccine side effects being described by our people. You asked about, is the vaccine mandatory? And so no, it's not mandatory. However, we are using all the avenues possible to empower our people with the information, the facts, to make informed decision, in order to take the vaccine. But it's not mandatory. None of our vaccines administered locally is not.
The question was if people coming in, do they have to be vaccinated to come in?
No, it's not mandatory. No.
This next question is: it still required for 150 persons, including officials and players, at sporting events? If not, why? Superintendent.
The regulation have limit the number of persons permitted at gatherings. For sporting events, we have taken a decision to restrict spectators, but we still permit the numbers, the 150 persons at the stadium. But this number should only comprise of officials, players, and other persons who are involved in the game, like the medical team, the media, the scorers, persons who are involved in the administration of the games, without spectators. Until we get to a level where we are satisfied with the vaccination level, we may have to continue to operate this way. So we continue to encourage and urge persons to be vaccinated, and this particular restriction would be lifted once we reach the level of herd immunity.
Thank you, Superintendent. This next question: does a company have a right to mandate its employees to take the vaccine?
That's a very interesting question. Let me begin by saying that in the Federation, taking the vaccine is not mandatory. However, an entity, an organization can conduct a risk assessment in terms of what's the risk of exposure to the virus in terms of its employees and clients. And if that risk is high, given the nature of the business, that employee, that company can strongly encourage its members, its staff members, to take the vaccine, because if they do not, the risk of exposure to the employees and to the organization would be significant. And so it's not mandatory. However, the organization can do a risk assessment, and if the risk of exposure to the virus is high, it can, there is a, it's ethical, an ethical position can be made or taken, and you can encourage your employees to be vaccinated, because it will be protecting themselves, protecting their clients, etc.
Another question is, a person's vacation, should a person's vacation, if a person takes vacation, should the quarantine period be counted as a part of the person's vacation?
The period of quarantine has nothing to do with the vacation. And so if you, for example, come into St. Kitts for a 2-week vacation and you know that you will be quarantined for 2 weeks, then it means that you'll be spending your 2 weeks in quarantine.
Okay, that brings us to the end of, wait, no, there's one more question. One more question. Now that the vaccine is here, does that mean that testing will be eliminated? Dr. Laws.
Now that the vaccine is here and that we have rolled out our vaccine program, testing continues. Let me just share, some information. One can be vaccinated, fully vaccinated with the Oxford AstraZeneca vaccine. But even fully vaccinated, there is still a risk of my picking up the virus and being able to transmit it to others. And so testing has to continue, because if I come down with COVID-like symptoms, anybody that present or show up, in the emergency room with COVID-like symptoms, we still have to test. So testing continues. Persons coming into the Federation from the hotspots, they go into quarantine still, and we have to test to make sure that they are free of COVID at the end of the 14 days before they can integrate into our society. So testing continues.
I thought I was through, but these are the last two. I sent an email to the Severe Allergies Organization in England, and they sent me a very interesting article saying that persons like me who are allergic to PEG should not take the coronavirus vaccines, since the coronavirus vaccines have polysorbate 80 in them. And the other one is echinacea cold and flu relief tablets appropriate for relieving the effects of the vaccine?
The other day, myself and the CMO were on a talk show program, and she listed the contents of the vaccine, because we said the AstraZeneca vaccine is a viral vector vaccine, and in addition to the viral vector, it contains a number of components like histidine hydrochloride, polysodium, polysorbate 80, which the person mentioned, sucrose, ethanol, injection water, etc. And if someone has severe allergies and they are allergic to any of the components within the vaccine, then it's advisable that they do not take it, since they might get an anaphylactic reaction. So if you are allergic to the polysorbate 80, then it means that you can't take the vaccine. It means that the persons who can take the vaccine, they are doing the ethical and moral thing in taking the vaccine to protect you, because we said it's not everyone who can take the vaccine, and the ones who cannot take the vaccine, we need to have herd immunity to protect them. And so sometimes I hear some healthy, strong person saying that, oh, they're going to be part of the 20 or 30% who would not take the vaccine. It's not like that. You have a responsibility. If you're fit, if you're able, and if you can take the vaccine, you should take the vaccine, because there's some persons who genuinely, because of their age, if they're at extremes of age, if they suffer with allergies, they cannot take the vaccine, and those are the persons who we need to protect. As it relates to the medication you just mentioned, that's an over-the-counter cough and cold medication, and anything that can relieve the symptoms related to the side effects can be used.
Thank you very much, Dr. Wilkinson. That brings us to the end of our question and answer segment for today. I do hope that your questions and your concerns were properly addressed. If not, you can always send a follow-up question, and we would be very happy to answer you and to clarify whatever concerns and to answer whatever questions that you have. I want to thank Dr. Wilkinson, Dr. Cameron Wilkinson, Dr. Hazel Laws, our main doctors, really, who are here at the NEOC COVID-19 briefing, providing us with reliable information with what is happening with respect to the COVID-19 pandemic. We thank them very much. We also thank Superintendent Cromwell Henry, who continues to provide us with updates with respect to the law. Of course, it is very, very important that we have a legal framework with respect to the COVID-19 pandemic. It is what really has kept us in terms of order in society with respect to the management of the pandemic. We thank Mr. Abdias Samuel, the chair of the COVID-19 task force. He keeps going and going and going and going like the Energizer Bunny. We thank Mrs. Christmas Jacobs for her continued dedication of sign language. And ZIZ, they're always there. It doesn't matter, rain or shine, they show up. We thank them for their commitment. We see AJ there today, and sometimes we have Khalid, and sometimes we have Miguel. But we thank them very much and wish, of course, ZIZ Radio, is celebrating its 60th anniversary, and we here at the NEOC wish them all the best. We continue to thank the communications team that has been in place since this pandemic began in this federation. The team here at the NEOC, the ones who would have organized the press briefings that we have been having, Vesta, Dr. Carty, Nigel, myself, we have been a dedicated team from the very, very beginning in putting the whole communications strategy together for these briefings. And I want to thank you very much. We also thank the Honorable Wendy Phipps. She is the co-chair of the Disaster Mitigation Council, and she continues to offer her support to the NEOC. She is here today to do just that. Thank you very much, Minister Phipps. I want to thank all of you for tuning in to today's NEOC COVID-19 briefing. We thank you very much for keeping abreast of what is happening, and thank you for the part that you continue to play in the management of this pandemic. Next week, we will be back with another press briefing with respect to the management, and we continue to encourage you, as Dr. Laws and Dr. Wilkinson and all of us are doing, please to take the vaccine. Thank you very much. I am Les Roy Williams.